So let's kick off now. Good afternoon, everyone, and a warm welcome to our CIFER webinar series. I'm Petra Meyer, CIFER Consortium Director and Professor of Public Health at the University of Glasgow. Over the past 5 years, CIFER has brought together policy and academic experts with practice partners in Scottish Government, Public Health Scotland, Greater Manchester Combined Authority and Sheffield City Council. We use innovative system science approaches to improve public health and well-being and tackle health inequalities. This webinar series of short lunchtime talks offers you the opportunity to hear directly from our team about this exciting work. Each presentation also gives you a chance to ask questions, and a full recording will be available on the CIFER website after the event. To submit questions today, please use the Zoom Q&A box, and we'll come to these at the end of the presentation. But you can ask your questions at any time. So today, I'm delighted to introduce our speaker, Dr. Lisa Garnham. Lisa is a CIFER researcher and a lecturer in social policy at the University of Strathclyde. As part of our Understanding Policy Processes and Evidence Needs work strand, her contribution today is focused on housing policy and evidence. Housing is a key building block for health, and housing policy plays an important role in shaping public health outcomes. Today, Lisa will offer an overview of our qualitative and quantitative research on the complex causal pathways between housing and health. She'll also introduce some of CIFER's exciting system tools that were designed to provide evidence on housing and health. Please feel free to submit questions anytime, as I said. Lisa, take it away.
Good afternoon, everyone. I'm Lisa Garnham. I've been part of the CIFER Consortium for 2 years, and I came to CIFER to support the development of the consortium's research on housing, and in particular its translation to policy contexts. So what have we got on offer today? I'm going to show you a range of ways in which we've used system science to answer questions about the impacts of housing on health, and highlight key findings from CIFER's research on this topic. Now, much of this work is not my own, but has been carried out by others within the consortium, including Kat Smith, Ellen Stewart, Nick Lomax, Rob Clay, and Robin Pershouse. And this will be very much a whistle-stop tour of our work on the housing topic, but hopefully it will whet your appetite to further explore what we've been doing. I'm going to start with some brief background to this work before sharing with you 3 streams of work we've carried out, their findings, and the evidence tools that we've created for policy audiences as a result of that. And finally, I'm going to offer some brief reflections on the process of using system science methods in collaboration with policy partners on the topic of housing and health. So for those of you who are new or newish to CIFER, it's worth just briefly recapping who we are. So CIFER is a UK PRP research consortium begun in 2019 and finishing this year. We use system science to address the complex real-world relationships and interdependencies of policies and population health outcomes. And this includes using qualitative and quantitative methods. Now, housing was one of 3 policy areas we addressed, and our work on this topic began just over 2 years ago, towards the end of 2022. Now, importantly, all of our work is carried out collaboratively with our policy partners, who are spread across England and Scotland, as well as different policy geographies. So we have Sheffield City Council, Greater Manchester Combined Authority, and the Scottish Government and Public Health Scotland. Now, at the start of CIFER's work on housing, we undertook an extensive scoping exercise. First, we looked at what was already established in the public health evidence base and reviewed the literature on housing and health. Then, we scoped the policy priorities and levers of our policy partners, reviewing housing and homelessness policy documents, as well as related policy areas like planning. We also carried out a small number of interviews with key people within those organisations. And finally, we reviewed the key issues being highlighted by housing advocacy organisations through their publications. What did this tell us? Well, in combination, it highlighted 2 areas of policy priority that have significant impacts on health and that we felt lent themselves well to a systems approach. And these were net zero and retrofit and the private rented sector. Now, of course, these sit within the broader housing system, so we were approaching these policy priorities with the wider system in mind. So now I'm going to talk you through three pieces of research and analysis we carried out on housing and health. Firstly, a tool that presents lived experience narratives alongside summaries of the evidence base on housing and health, and an associated analysis of those different perspectives on the system. This strand of work looked at the whole housing system. Secondly, a strand of work based on Cypher's synthetic population and Minos dynamic microsimulation that features a data dashboard, an analysis of the health impacts of two energy policy interventions, and has led to the creation of a decision support tool to optimize retrofit intervention for policy audiences. And thirdly, a piece of work that explored how local authorities might support both landlords and tenants in the private rented sector to improve health outcomes that use participatory systems mapping. So firstly, I'm going to talk you through our strand of work on lived experiences and evidence pathways from housing to health. So like I said a minute ago, there were two main outputs from this work, and I'm going to talk you through our analysis of a comparison of those multiple perspectives on the housing and health system first. So in undertaking this analysis, we compared the answers to the question, how does housing impact on health, from three different perspectives using systems mapping. Those three perspectives were the causal pathways considered to be established in the public health evidence base, those that made up the mental models of our policy partners, and those that had been experienced by Cypher's community panel members. To do this, we used the evidence-based systems map created during our scoping phase that I mentioned at the start of this presentation, as well as the participatory systems mapping we carried out with housing and health policymakers at Greater Manchester Combined Authority. And there's actually a very short briefing paper about this specific bit of work on our website under the publication section if you're interested to see that. Now, to complement these two perspectives, we then carried out participatory systems mapping with Cypher's three community panels, who are located across the UK in Fife, Greater Manchester and Sheffield, and who all had lived experience of housing and/or health issues. Now, comparing the maps created by these three processes, we found significant alignment between the evidence base and our policy partners' views, which we'd argue reflects policymakers' bird's eye perspective of the housing system and the very strong hierarchy of evidence embedded within both public health and policy making. This elevates experimental and quantitative evidence above other types and has a much stronger focus on physical health outcomes than mental health or well-being, as this is in many ways easier to measure and has much greater quantities of routine data available for analysis. The perspective from lived experience, however, was markedly different from the other two and offered insights that were not adequately reflected in either public health evidence reviews or policymaker perspectives. And these included three main areas. The first was the importance of processes and procedures that people need to follow to secure good housing outcomes in shaping their housing experiences and their exposure to stress. So, for example, claiming housing benefit or requesting repairs. This is important because we often measure housing outcomes as markers of success rather than the experiences of achieving those outcomes and consider the toll that they might take on health in the process. The second is the overriding experience of power or powerlessness and how strongly this shaped the mental health impacts of housing. This was not a well-established pathway in the public health evidence base, despite emerging qualitative work on this topic from within housing studies. And our findings align with research on the deep impacts of housing precarity on well-being and its systemic nature. Thirdly, intersectionality. Many aspects of personhood shaped how housing was perceived and experienced. This is not yet established in the evidence base, with most studies focusing on discrimination denying access to housing, rather than how these experiences impact on health outcomes, even when housing is secured, despite discrimination. And publication of these findings is currently under review at the Journal of Critical Public Health, but the takeaway is that a significant broadening of the evidence base is clearly required, and this needs to be in a form that policy audiences can trust and can use. We then used this work to develop the Cypher layered map, Experiences and Evidence of Housing and Health. We wanted to address that disconnect between some parts of the evidence base and what Cypher's community panels were telling us was central to their lived experiences. And we wanted to do this in a way that was visually appealing and gave space for the map to tell a story about why that housing and health connection is so important. So we commissioned a software developer and an illustrator to develop a map visualization tool for this purpose, the Cypher layered map tool. And we then use this tool to build the experiences and evidence of housing and health map. Now, this was designed to combine pathways from review level academic literature with those highlighted as pivotal by CIFER's community panel members, present stories from people with lived experience who were CIFER community panel members to ground and deepen understanding of those pathways, include brief evidence summaries from the academic and grey literature, providing curated links to the evidence base, break a large unwieldy systems map into more digestible segments via themed submaps, and include illustrations for ease of viewing, providing somewhere for the eye to rest while looking through the map. Now, if you'd like to explore this tool, it's available on our website in the CIFER product guide, and there's also a methodological report there detailing exactly how we curated the content of that map as well. So, moving on to the second of the 3 strands of work I'll be talking about today. The CIFER synthetic population is a representative dataset of individuals within small areas of Great Britain. We constructed these data because there's a lack of evidence which connects the key areas of interest for the CIFER consortium, including housing. And the synthetic dataset combines survey data from UK Household Longitudinal Study, census of population, and mid-year population estimates to create a high-resolution dataset that can be explored on its own or used as an input into dynamic models, which is one of the things that we do within CIFER and something I'll explain shortly. So the data have been made available via an interactive dashboard, which looks like this and is available again under the product guide section of the CIFER website. It covers the whole of the UK, and key housing variables include tenure, household composition, a measure of thermal comfort, availability of central heating, and council tax band. Now, the entire synthetic population dataset has also been deposited within the UK Data Service, where users can access and download the files for use in their work, and comprehensive metadata is also available from the UK Data Service. So within CIFER, the MENOS dynamic microsimulation model has been developed to estimate the health impacts of housing retrofit policies at the household scale. So dynamic microsimulation is an individual level modeling technique that creates a population of individual entities, such as people or households. It then projects them forwards in time under hypothetical policy scenarios to estimate the long-term complex human behaviour and optimise government decision-making. We use CIFER's housing and health system mapping to create a series of transition dynamics models that emulate the ways in which household energy interventions impact on household disposable income and how this in turn affects households and individual characteristics, including mental and physical health outcomes. In the MENOS model, these dynamics are applied to a 10% scale of the synthetic population of Greater Manchester Combined Authority to determine the cost and health gains of different policies over 15 years from 2020 to 2035. So the analysis shows 2 housing interventions that have been applied to the MENOS model. The energy price cap guarantee is an ongoing cash transfer, reducing the mean yearly household energy expenditure according to a cap set by Ofgem. To model this, income is provided to households proportional to their existing energy expenditure until the mean income is below the required cap. Secondly, the Great British Insulation Scheme provided households subsidies to retrofit insulation subject to eligibility criteria, including council tax bands and property energy performance certificates. So to model this, households were provided with an initial lump sum of £7,500 with further funding dependent on household characteristics, including, for example, external surface area of the property. Now, this intervention both improved thermal comfort for vulnerable households, as well as saving money on yearly energy bills long term by reducing overall consumption. And using the MENOS model, both policies were run for the Greater Manchester Combined Authority population through to 2035. And on this graph, the y-axis shows the incremental cost-effectiveness ratio of the 2 interventions. And we can see that despite the Great British Insulation intervention having a high initial capital cost, it quickly becomes more cost-effective than the energy price cap guarantee policy. This is because the Great British Insulation Scheme is more targeted, as it provides support to households reporting poor thermal comfort. It also has very little cost beyond the initial year, beyond 2021, which contributes to this gradual improvement in cost effectiveness over time. However, it's worth noting that neither of these two interventions are particularly cost-effective as public health interventions, as they cost over 10 times the cost threshold set by the National Institute for Clinical Excellence for improving healthy life expectancy. I'll come back to what we can learn from this in the context of CIPHER's other housing work at the end of the presentation. So in addition to the modelling, CIPHER's Decision Support Tool, or DST for short, is an outcomes-focused approach to thinking about policy problems. So CIPHER has created DSTs for previous work on inclusive economies, but its final case study looks at housing retrofit in the Greater Manchester Combined Authority area. Now, the outcomes for the case study have been developed with policy colleagues at GMCA and encompass physical health, mental health, health-related quality of life, and equivalent income, which is a measure of well-being, more information about which you can find on the CIPHER website. In addition to trying to improve all these outcomes for the population of Greater Manchester as a whole, colleagues are also interested in reducing the inequality in these outcomes between more and less deprived people within Greater Manchester. The final outcome to focus improving thermal comfort in households with young children who are living in poverty. Since resources are limited, there is also a constraint on how much can be invested as a whole on retrofit interventions. And the CIPHER DST looks at thousands of combinations of targeting options for retrofit in Greater Manchester. For example, which housing tenures to target and which communities to target. It uses CIPHER's microsimulation to estimate the impact on the outcomes of each targeting option. Now, this is very much work in progress, but this image you see here shows you a sample of the kind of output that we can produce. And the first results from this analysis are due before CIPHER's official end date in March, so do keep an eye on the CIPHER bulletin and of course our website for updates. So finally, moving on then to the last piece of CIPHER research that I'd like to tell you about this afternoon. This project is focused on the private rented sector in a Northern English city. So our policy partner was undertaking a review of their housing strategy, and the private rented sector was a key area of priority. It was an area in which they felt they needed more intelligence on the issues within their specific context. And it was also a policy area in which they were grappling with what the effective policy interventions might be, given the relative lack of policy infrastructure around the private rented sector and the need to balance the demands of both tenants and landlords. So we undertook participatory systems mapping with a group of 7 tenants and a group of 4 landlords from across the local area in 2 half-day workshops. We mapped with those 2 groups separately. The aim was to trace the long chain causal pathways from housing experiences in the private rented sector to health outcomes in this specific context. And from the physical maps created by tenants during the workshops, which you can see here in this image, we created a digital systems map in Kumu. And that's a visual of that map there. And we carried out an analysis of this map and the conversations had by tenants and landlords during their workshops that we'd audio recorded, and mapped these onto 4 high-level themes that had been identified by our policy partner as a priority. And we wrote a report making some detailed recommendations, which again you can find on the CIPHER website under our publication section. The key findings of this research were as follows. So first of all, the quality of repairs and maintenance services was central in shaping housing experiences and mental well-being among tenants, and the development of guidance for landlords should highlight and include this aspect. Secondly, more general guidance and support for both tenants and landlords in the private rented sector is needed to build trust and cultivate non-adversarial relationships between landlords and tenants. There was a view among landlords that the increasing professionalisation of landlordism has contributed to increasingly adversarial interactions with tenants. Thirdly, a sense of control and choice in housing is crucial in underpinning good mental well-being and better health outcomes more generally for tenants. While increasing housing supply is of course the underlying solution to this problem, relatively small changes to the rehousing experience may also support a better sense of control for tenants. And lastly, cultural segregation, discrimination and racism play a significant role in shaping neighbourhood experiences of residents from a wide range of ethnic backgrounds, and work to build bridges across communities could significantly improve neighbourhood experience regardless of tenure. Like I say, if you're interested in seeing more detail on this analysis, the report is on our website in the publication section. So I've presented a range of system science tools and analyses to you today. Some of those have been primarily designed to allow users to explore the housing health system and generate fresh thinking, while others have been more focused on working through the detail of how interventions might impact on health. I hope the range we've shown you here today has given you some food for thought on both how important it is for us to improve the empirical evidence on the pathways from housing to especially mental health, as well as the potential for system science approaches to achieve that. We saw from the modelling work that the pathways from housing to health are multiple, even for relatively simple single-point interventions like energy caps or retrofit. However, the two qualitative analyses show that there are many aspects of the housing experience that have a significant impact on mental well-being that are difficult, if not impossible, to quantify or capture objectively. And this has implications for physical health as well, given what we know about the close coupling of mental and physical health outcomes. The crucial role of these harder to measure aspects of the housing system on health perhaps explains the relatively low cost effectiveness of the modelled energy cap and retrofit interventions as public health interventions. And this raises some important questions about future research on the impacts of housing and health, and how it can be best framed for and explained, given that policy decision makers need better evidence on which policies might offer win-wins across policy areas like housing and health, and of course, value for public money. Looking across the whole system to understand the impacts of housing on health does demonstrate impact, but we face a challenge in setting the boundaries of our analyses to increase its value for policy audiences. This type of whole system evidence sits alongside other evidence that explores more straightforward direct pathways where outcomes are perhaps more easily measured, and finding a way to make the complex understandable and useful without over-constraining our analyses is vital. Thank you very much for listening today. If you're interested in specific pieces of work I've mentioned, please do get in touch at the email addresses on this slide, or indeed at our whole team email address, which is cipher@glasgow.ac.uk. Thanks.
Amazing. Thank you, Lisa. We now have an opportunity for questions. If you've not already submitted these, please use the Zoom Q&A tab and we will get to as many as time allows. So I've got a first question for you here, Lisa. How did you decide which outputs and population groups to focus on when developing the decision support tool?
Thanks, Petra. So this was very much an iterative process that really was driven by our embedded researchers. So Cipher has embedded researchers across our policy partners, and in the Greater Manchester Combined Authority area, Abby Finn has been hugely instrumental in bringing together what the housing teams are really interested in terms of the decision support tool and what they would like it to be able to do, and the team who are actually building that as a tool. That's really involved a lot of presenting what might be possible within the tool, and then kind of using that to guide how the tool is developed in a very iterative process that's gone back and forth over a number of weeks. So it's very much a kind of collaborative process that we use using our embedded researchers to facilitate that process.
Thank you. The second question I've got here is, have any of your policy partners or others used the layered system map you showed? And what did they like about it? And maybe what didn't they like about it as well?
Yeah, good question, Petra. So yes, so we ran some user testing on our layered systems map not long after developing it. And really the feedback that we got from our policy partners was that they loved the kind of the very clean, minimalist presentation, the fact that it looked very uncomplicated despite being quite complex, and the ability to break down the map into different themes. We found that people who were certainly in that policy making space where they were thinking about what might happen or what they might approach or what they might do, and particularly more senior policy decision makers, really loved the tool for the fact that they had the ability to kind of explore different pathways and maybe think outside the box a little bit. I think perhaps as we expected, people who were undertaking more of an analyst role found that the level of detail on the evidence that's provided in the map and the links to further evidence needed to be much, much more detailed. And in fact, the more we thought about it, there are other Cipher products that that kind of fit that criteria a little more closely. So for example, on one of our other topics, we created an evidence and gap map, and that seems to kind of fulfill that purpose a little better than perhaps the layered systems map. So yeah, different people liked different things about it, and it really did help us to understand what our audience appreciated about it through that process.
Thank you. So here comes a longer question. Let's see whether you've got an answer or whether it's something where you can signpost. So I'm very interested, Kate says, in the data and assumptions behind the micromodeling, both on the size of the health impacts and the size of the impacts and interventions, as we know modeling in SAP does not relate very closely to what happens in real life. So if you can give a quick insight, great, but it's a long question. So is there anywhere where I can find out more?
Yeah, so that's a great question. And as you pointed out, modeling is always a simplification of the real world, and it can never include all of the things that happen in the real world. Much of the kind of underlying process of developing the pathways within our model came from the main data sets that we've used to underpin the model, but there is documentation on the Cypher website. If you go into our product guide and then look under the MENAS microsimulation model, it gives you a lot more detail there than I can cover, especially because modeling is not my area of expertise within the Cypher team. But yeah, there is documentation there that explains exactly what those structures are and where they came from. But yes, you're quite right. Modeling always takes a partial view in order to simplify, to make something complicated feel a little simpler for the process of decision making. So yeah, it is always a compromise and a balance.
And related to that, is the MENAS model policy comparison, are those results published? Someone wants to know.
That's a good question. Petra, do you know the answer to that? I mean, I know that all of our analyses will eventually be on our website, but I can't say for sure that it definitely is at the moment.
I think at the moment they're still sitting with the policy partners. Alison, you may correct me if not, but they should be on the website very shortly, if not. If you're a subscriber to the Cypher Bulletin, you will be notified once they become available, or they might be covered in the last one indeed. But yeah, definitely the intention to have everything on the Cypher website before the end of the funded period, which is approaching quite rapidly now. Question 5 is from Alex. Does Cypher modeling calculate the impact on specific health conditions caused by the current housing stock? I think I can answer, but you can as well.
Yeah, so that is a good question. No, it doesn't. So it Petra, do you want to give? I feel like you could give a longer, more technical answer to this. So
I don't
I'll let
think
you.
it
I'll pass to you.
needs a technical answer, but no, it doesn't. It basically calculates the difference in SF12, so a general health, mental health, and physical health, and overall health component score. It does not relate it to particular health outcomes like air quality, indoor air quality, or any of those things. We did literature reviewing around those, but in terms of modeling, that is really difficult because it then depends on what assumptions you make about the interventions that are happening and exactly what that will lead to. And that's data that we didn't have available. So no, it doesn't really. Any more questions? Oh, last question. Yes, we're running out of time. So are these tools available for everyone to use, or do you need to be a team member?
Yeah, so at the moment, those tools are being tested with our policy partners. There may be scope for us to develop them more for additional audiences. The difficulty largely is technical, so it's how to take what is a fairly complex bit of modeling and then create an interface for users to use. So in some respects, the data dashboard was an attempt for us to begin that, and that is publicly available. So if you go on our website, anyone can access that. There might be a pop-up box that asks you for your email address so that we can keep track of who it is that's using it and why they're finding it useful, but the data dashboard is publicly available. At the moment, the modeling and the decision support tool, particularly the decision support tool because it's still in development, are really only being used by our policy users. But as Petra said, if you keep up to date with the Cypher Bulletin, if and when things are made publicly available, that will be on the Cypher Bulletin. And if you do have an interest in using these tools, please do get in touch with us. Either the email addresses that I provided on the slide or just our generic Cypher email address, which is cypher@glasgow.ac.uk.
Yeah, I should add that it's not about not making tools publicly available. We're just not quite there yet with the decision support tool. I think Minos, most of the things do live on GitHub, and there are links in the product guide. The data is certainly available. The synthetic population, layered systems maps, all of these things are already on the website, as will be outputs. But again, if there is something that you want to use it for, get in touch. Nick Lomax is just really interested in talking to anybody who has use for Minos or wants to build on it going forward beyond the life of Cypher, certainly. Oh, we do have one more question. Sorry, I said last question, but this is the very last question. Given that the government are pushing towards higher density housing, this type of housing is likely to be targeted at more deprived communities. There's research that mental health in these denser, high-rise developments is worse than other types of housing. Do you have any research on this problem, or also mental health impacts of co-living in non-cohesive households or HMOs where residents don't know each other and so on?
That's a really good question, and is unfortunately one of the things that wasn't covered by the qualitative research that we did. So I think this is a good example of the way in which when you select a frame for your qualitative research and the participants who you're able to get in contact with and who come along to create systems maps with you, that really does shape the conclusions that you're able to draw. So we did focus on the private rented sector in the participatory systems mapping work that we did, but everyone who came along to those workshops was living in a non-HMO and a non-high-rise setting. So I feel as though that would be an excellent topic to explore, but of course you'd have to specifically recruit participants that had that experience. And like you say, there is an emerging evidence base that this is it may be problematic, or there may be aspects of these developments that are problematic, but it is important that we explore exactly what those pathways are. It may be that it's not necessarily high density living itself that's the problem, but that a lack of sound insulation, thermal insulation, and the types of developments or who they are targeted at is actually the issue. And that's why it's important to kind of map out what those causal pathways are. So yeah, not something that we covered, but definitely something that could be covered by further research, and mapping would be a great way to do that.
Thank you, Lisa. And thank you all for joining us for today's webinar and for all your questions. A full recording will be available on our website soon, so please watch out for that and feel free to share with anybody who might have been unable to join today. We are hosting our final 2 Cypher webinars next week. The Complexity of a Systems Approach to Health Inequalities in the session, Corinna Elsenbroich, our Cypher co-director and reader in computational modeling based here at Glasgow, explores how Cypher's unique approach generated new insights and helped transform overwhelming complexity into actionable policy solutions. That's on next Tuesday, on the 25th of February. And then the final webinar is the evaluation of a complex systems science program, learning from the work of the Cypher Consortium. And in that final webinar, Dr. Liz Such, who supports our evaluation work strand and is an Anne McLaren Fellow at the School of Health Sciences, University of Nottingham, will reveal that evaluations of complex system science programs are uncommon, as she focuses on how we've developed to deliver on our ambitious 5-year program of research. The full details of those 2 webinars are also on our website. We hope you can join us. Thank you again, audience. Thank you, Lisa, and have a great day. Bye.